Hi, my name is Martin Walsh. And today we are going to be talking about the syndrome of inappropriate antidiuretic secretion. Um, this is a uh, issue within the body that is caused by inappropriate release of vasopressin that influences our body to retain water, thereby diluting our blood and giving the appearance of hyponatremia, which is, a dangerously low amount of sodium in our blood system. Uh, Typically, our body would automatically release the hormone to retain water when needed and stop its release when we need to expel water to maintain homeostasis. Some of the causes can be enhanced by a large number of central nervous system disorders, and then I will do a brief list at the very end, just based on time, because those are also part of that comorbid, um, series of syndromes that can lead to this. Um, Other ones, such as ectopic vasopressin, may be produced by certain cancers within the body or pulmonary disorders. Other uh, means or other causes include certain drugs like oxytocin and desmopressin. There are five actual drug classes that are most often implicated or responsible, such as analgesics like opioids and NSAIDs, anti-seizure drugs like carbamazepine, antidepressants like certain SSRIs, antipsychotic drugs, and cytotoxic drugs. Um, as far as manifestations go, um, because because its effects cause hyponatremia, all the signs and symptoms will be related to hyponatremia. So we'll see subtle symptoms in the beginning, consisting mainly of changes in mental status and altered personality, lethargy, confusion, almost like getting into a delirium. As the sodium levels fall, stupor, hyperexcitability, hyperreflexia, um, seizures, coma, and eventually death will result. Medications and interventions for this particular syndrome is typically IV conivaptan, which is a selective vasopressin receptor antagonist, will be used, which causes effective water diuresis without loss of electrolytes in the urine, and it can be used in hospitalized patients. Oral tolvaptan is another receptor antagonist similar to the conivaptan, um, and that can be taken for up to 30 days long, I believe. And um, as far as interventions go, IV hypertonic saline can be infused, which will help change our concentration gradient within the body, bringing more salt and pushing excess water out, and sort of stabilizing our ECF. Okay, we got about a minute left here, so going back to concurrent complications and the original causes list, we can look at stuff like certain cancers, especially central nervous system, duodenum, lung, especially small cell carcinoma, lymphoma, and pancreatic cancers. Our neurological disorders that could cause this are acute intermittent porphyria, acute psychosis, brain abscess, encephalitis, Guillain-Barré, head trauma, meningitis, pituitary surgery, stroke, subdural or subarachnoid hemorrhage, pulmonary disorders, aspergillosis, lung abscess, pneumonia, positive pressure breathing, and tuberculosis. And for a few other miscellaneous ones, they also include acute intermittent porphyria, HIV infection, protein, energy, undernutrition. So that is a brief rundown of syndrome of inappropriate antidiuretic hormone secretion. Thank you very much.